Good morning, everyone. Today I'm here with Sequoya, one of the person with the most particular name I ever met, I have to say, but it's a different story. And Sequoya has been one of our midwives, and she has been the not main protagonist. Katya was obviously and Axel,
Yes.
but the main midwife while we had Axel, the delivery. And even though you're still studying, right? So you're still studying to become a midwife, and we've been feeling really honored and good in your hands, because you've been a very, important character in that very important time of our lives. And we're gonna just dig a little bit farther into midwifery, into home birth, and knowing also one more perspective about the entire world of home birth and natural birth. So, good morning, Sequoia.
Good morning.
Thank you for having us and having me in the studio.
Yeah.
And so I would just start a little bit with your story about how you got into midwifery, which I remember telling us, and it's kind of particular. So I'd like to just introduce yourself and tell me a little bit your story.
Yeah, so my name's Sequoia. I'm a student midwife at McMaster University, and I'll be graduating quite soon in April. In the program so far, I've already been to over 100 births, and I think most students have a very similar experience by the time that they graduate. So how I got into midwifery, I did an undergrad, I did a Bachelor of Arts in Film Studies with a minor in Law and Women and Gender Studies. And through that, I actually started analyzing films from a feminist perspective in terms of how motherhood is represented in our society, and got an interest in that. And then kind of through finding Women and Gender Studies, I was actually taught one of my courses by a midwife in Ottawa. And she was kind of this like typical grassroots midwife that you would imagine, like long silver hair down to her bum. And I just was kind of in awe of this person and what is this profession and what do midwives do? And I put it on the back burner for a little while, did some other jobs, and then decided to apply to the program and got in, and have kind of felt like I've been home ever since. So it's been kind of a nice journey, and and lots of fun.
Okay, so you've been studying, you said, the feminine perspective of movies. So can you talk a little bit about it? Since I think it's quite important.
In terms of the culture.
Exactly.
Yeah, so I think kind of leaving out most of the movies aside, but I think that in our society in general, we're very critical of mothers, and we're very critical of mothers' choices, and being a mother is very political. Being a parent is very political, and choosing to have a midwife to care for you is also a very political decision, as we know, and especially when you're choosing a home birth, because when and where and who you decide to care for you during your pregnancy, birth, and postpartum is a very important choice, and a very political choice, because all of women's bodies. Political? All of women's bodies' choices, they're always political. Like when you have tattoos on your body, people just they think that they can touch you right away. Somehow they have access to your body. Women's choices when they're giving birth are political, because you're carrying a life that isn't necessarily yours. So all of these choices, they come into play in our society, and we're the people that are bringing new life into this world. So it's it's kind of an interesting topic to think about, as your body being a political thing.
And do you think generally the image that is given through the cinematography, the movie industry, is it helping mothers to,
No.
choose? Exactly. So.
Yeah, not at all. Particularly in American cinema, there's lots of blame for women's choices and a lot of sensationalism around birth. Like you'll see people's waters break, and then all of a sudden they're screaming and they're in rip-roaring labor, and it's not how it works, unfortunately.
Not really yellow.
Yeah, I mean, we've seen it, but certainly not normal.
Well, in the cinema is the standard, while in reality is the exception, right?
Yeah, exactly. And then I've seen in Asian films, for example, that they just treat their mothers in a very different way. There's not the same kind of blaming for, like in horror movies in particular. But I mean, I won't get too much into it, but it's just very interesting how we construct motherhood in our society, particularly in North American culture.
But why do you think the cinema is just showing more that part that is in nature, in reality, the exception, and not what is really happening in reality?
Because real birth, I don't think, is necessarily sensationalist and perhaps not really entertaining. Like, it's more entertaining for someone to have their water break and then have a baby 5 minutes later and then have like a crazy postpartum hemorrhage or something that is filled with drama and all those kinds of things. But normal birth isn't like that. And a lot of birth is just actually about patience. It's kind of slow, and you do one contraction at a time. You know, they're 2 to 3 minutes apart. It's not, you know, it can be hours.
You're not biting the hand of your husband and then screaming like...
Exactly. I mean, sometimes, but the majority of the time, it's a very natural, slow, physiologic process, and you just have to be patient. And I don't think we're very used to being patient in our society either.
Unfortunately.
Yeah.
So so you said that it was a kind of natural flow for you to get into midwifery, right, through this course. And how has been a little bit the process? I mean, now you are at how many years you have been studying already?
So it's a 4.5-year program.
Okay.
And so I'm finishing in April. So I have the 3 months left once we're in January.
And before that, you'd never imagined that you would get into this, right?
No, I didn't really even know midwifery existed until I had that course and that Women and Gender Studies course with that midwife that was actually teaching it.
Interesting.
I had no idea that it existed or that it was a profession, and I've just thought that it's the most amazing profession. It's so interesting, and what a gift and privilege it is to care for people and families in kind of a really important time in their life, and keep those people safe.
Let's maybe get a little bit into home birth, or natural birth, which is most common, because as we got to know, it's more or less 20% of your clients here that they have actually home birth, right? But most of them, they have a natural birth.
So the majority, we do have very good success rates in this community with natural birth, for sure. Midwives in Ontario are attending about 16% of the deliveries overall, so that's just over 20,000 deliveries every year, which is quite a lot. And then, as you said, about 20% of the people in this community are doing home births, and most people are successful in having a home birth. People's reasons for wanting to have a home birth, they really vary. So people might want to have a home birth because they've had a negative hospital experience, or they've had families that have had negative hospital experiences, or they're just kind of afraid of the hospital in general. Some people are really committed to having a natural home birth, and then that's their decision. Some people are extremely low intervention, and they know that having a midwife will decrease your rates of intervention overall, and they know that just by planning a home birth, you're more likely to have a successful vaginal delivery. So I think people, for lots of different reasons, choose those things. And a lot of people just feel safer at home. It's nice to stay home and be in your own environment.
Warmer and cozier. So what would you tell a little bit to women generally, or what is your message as a midwife, of course, about home birth? So how you would... Probably you do it every day when you meet people, when new people or friends, etc. What is your message that you give, and how you approach the discussion, how you sustain home birth versus, let's say, hospitalized birth?
Well, your place of birth is your choice, and that's one of my favorite things about midwifery. Is one of our pillars is informed choice. So that's basically this idea that you are the person that's in charge of your healthcare, and we will provide you with all of the information, studies, research, benefits, risks, and alternatives of any kind of procedure or even choice of birthplace, and you're the person to decide whether or not that's appropriate for you. So when we talk about home birth, we talk about people that are appropriate for home birth. So low risk, people that are having a very straightforward normal pregnancy, and we don't anticipate that you're going to need a lot of intervention in your birth. For example, someone that has had a previous cesarean section, we know that your chance of having a uterine rupture is a bit higher. So we might not necessarily recommend that you have a home birth, just because we know that the recommendations are to have EFM, something that we can't do at home, those kinds of things. That being said, if we have an appropriate risk-benefits discussion, and that's still your choice, we'll support you in that. But we're able to kind of fit people kind of into boxes of who is a safe candidate and good person to have a home delivery.
Okay, so and depending on that, then of course is the mother choice anyway where to have birth, but you're gonna let's say, approach the birth differently according to the kind of amount of risk there can be, or it's just...
Yeah, potentially. It has to be a discussion between the client and the midwife herself, right? If she is not comfortable doing that either, there's lots of layers to that as well. One of my favorite things about having a home birth or going to attend someone who's having a home birth, like for your birth, for example, we came to your house at like 4 o'clock in the morning and everything's like dark outside and everything. And when we left, we kind of just tucked you guys into bed and kind of just left you there. And when we go outside, it's still dark out because it's 4 o'clock in the morning and no one in the neighborhood is awake. And no one knows that we've just tucked you in and delivered a baby. Is so special. And there are very few healthcare providers that actually go attend people in their homes. And that sense of intimacy is just really, it's just unparalleled, and it's very, very special. And I feel very privileged to actually go into someone's house and care for them in their space and then tuck them into bed and say, we'll come see you tomorrow for any further up, testing and that kind of thing. Going into the hospital, it's exciting. It's like, it's a birth. It's always fun. I think we have really, really great relationships with the hospitals in Ontario and great relationships with our consultants and physicians and nurses. And so the birth at home is it's just a midwife party. There's no one else around. So there's that joy in that as well, and the intimacy of it all. But the hospital birth is fine too. I don't really have a preference for either or, because it's not about me, it's about my clients. So I don't really care. Home birth is just fun. There's lots of, it's just really special. But hospital birth is, you feel comfortable there too. But we have all the equipment that we need at home. We have all the equipment of basically a level 1 hospital. So I can do an IV for you at home. I can give you antibiotics and manage a postpartum hemorrhage and intubate a baby. There's all different kinds of things I can do at home. So I have all of the tools that I need to feel safe in both environments.
From my feelings, it's like you are really on the path of, you chose your path and you're really into it and you're gonna make it for the entire life, right?
Yeah, I mean,
I can see.
If I was just a midwife that did hospital birth, I don't think I'd be very happy. So I think the really beautiful home births when you catch a baby in the water and, it's just a very overwhelming emotional experience. Those are the beautiful births that keep you going for any of the other hardships that you have as a midwife.
But what would you also, to reassure people that it's a safe procedure to have, what do you say?
In Canada, we're very, very lucky. We have, particularly in Ontario, very, very well-trained midwives. And our midwifery is very different in terms of kind of all over the world, because we care for you from the moment you're pregnant all the way until 6 weeks after the baby's been born. And I think that a lot of the misconceptions about home birth safety actually comes back to not only our idea of pathologizing birth in general, but also this idea that we don't really know what midwives do. And so there's misconceptions about what a midwife actually is. So we're not actually coming to your house with just a stethoscope and a Doppler and that's it.
That's probably the image that many people have, like somebody not so much trained, but she's just supporting.
And so that's why I think there's a lot of misconceptions, because people don't know that we come with all of the equipment that we do. Like I was saying earlier, for IVs and intubation and resuscitation equipment for mom and for baby. And
it's a 4.5 years training, so you learn pretty much, I guess.
I've had lots of people ask me is that a weekend course? And it's like, no.
Not really.
So it's just interesting. We can prescribe medications and order ultrasounds and blood work and all those kinds of things. And I don't think people understand all of that. I don't think that people understand what a primary healthcare provider is. And people in the biz of medicine, they can kind of understand, oh yeah, I know what that means. But to the average person, they don't know that means that this person is the most responsible person to care for you through this process. So we don't necessarily have to talk to a doctor unless there's something that comes up that we need to. But really, we're the most responsible person, and we don't have to have a doctor sign our requisitions or do all of those things. We are doing all of our testing, and all of our choices are on our own authority. So I think that that's a bit of the misconception about home birth. And there's been lots of really good studies that have shown that for low-risk people, home birth is just as safe as hospital birth, if not sometimes safer. And that we actually know that people that plan a home birth have lower rates of interventions, including C-sections. So we know that having skilled midwives attend your birth, that you're going to have a very safe birth, statistically speaking.
And is still this all over the world the same? Like midwives, they are all over trained as well as they are in Ontario or in
Not
Canada?
Not necessarily. Midwives all over the world, I mean, we've been around forever, literally, since babies have been born. Particularly in Ontario, this is how we're trained. I can't speak to every single country, but I know that the way midwives are trained in different countries is very different, but also incredibly amazing. And midwives all over the world are quite skilled. But it just depends on what community they work in.
Sure. Yeah, I can also, I don't really, that's why I ask you, because I don't really know what is in other countries. I know from New Zealand and from Canada. I know that both countries, they offer very, very high quality midwifery, but I don't really know back in Switzerland and Italy, as I said. So it would be interesting probably to interview other midwives back in those countries. Yeah, definitely.
And we're very well integrated into the hospital system. We can admit you and discharge you from the hospital. We have great relationships with the doctors, and also really great relationships with paramedics too. So in Ontario, you're gonna, in most communities, you're gonna call 911 if something bad was happening at a home birth, and be able to get to the hospital in a reasonable amount of time. And you know, we train together, and so it's safe because we're actually able to get you to help if needed. And because we're experts in normal birth, when things are not going normal, we can tell. And we can do the appropriate interventions in a timely manner. So I think, and
eventually get to somebody that's expert in non-normal birth, right?
And most of birth is very normal. Yeah.
Good. And how much is the more or less the ratio for you so far? You said that you followed more than 100 births, right? So how many were home births?
So I've had, now this is my second overall midwifery placement, and I think I've attended over 10 for sure home births. So I think I must have just over 10% home birth rate. In my personal experience, the data can be a little bit skewed because a lot of the births that I've attended have been with an obstetrician in my obs placement, where I was assisting in surgery and that kind of thing. So we have lots of varied experiences, and we attend births in different places, in different environments. So with nursing and with obstetricians. From
these over 100, how many were natural births?
Oh God, I don't know.
You don't know? Okay.
I have no idea. Yeah.
Why do you think is epidural still so, common and so much sustained and so much even wished? I learned from some women. It's just fear-based again because they don't want to go through the process of pain, or? Yeah,
pain. Particularly, for first-time mums, you just don't know what it's going to feel like until you're in the moment, and so that's very scary. And fear is the biggest thing, right? And when people are afraid, they feel more pain. So when people don't have any kind of experience with labor, then of course they want some kind of relief. I do think that epidurals have a really, really good place in obstetrics, particularly when someone has suffered like a sexual trauma or some kind of emotional trauma that they're unable to cope with such pain. It can be therapeutic and very beneficial. But for people that want to have a natural birth, then they can certainly do it.
And how is your approach when you, for example, a new mother, that haven't had a birth before, is coming to you? How do you approach the theme of epidural? You propose it, you say it as an option, of course, I guess. So how is the, this kind of discussion with a mother to be?
Yeah, well, we talk a lot about pain and fear and what kind of things.
Because you're not mother yourself, right?
No.
Not yet. Okay.
So what kind of things in your life have been scary, or what kind of things have brought you strength, or what kind of things have you gotten through on your own, those kinds of things. and everyone's so different. So we talk a lot about just the mental aspect of childbirth. In labor, we talk about kind of doing one contraction at a time, that kind of thing. But what I do with a lot of my clients is actually have a safe word for an epidural. So you could ask for an epidural all you want, but until you say pineapple or pepperoni or whatever, that's when you really mean it, that you want your epidural. And I think that gives people permission to ask for pain relief, even if they don't necessarily want it. But they're able to kind of use whatever coping mechanism they want.
And how often do they use the special word?
I think 3 times I've had people use their safe word for an epidural.
Most of the time they anyway cope with the pain, and they can go through the natural birth. Right?
And having a person that you're connected with and you feel like you can emotionally support them is a big factor in not having an epidural. So partners are a huge piece of it. Doulas are another part of the equation. Having a doula at your birth will decrease your need for an epidural substantially. So they're a very particular, specially trained support person, and they're really fantastic. So things like massage, water, therapy, all different kinds of things that we can use to make labor less painful. But again, if people feel safe in their environment, they're less likely to be afraid and then less likely to fear.
They can cope better with the pain.
So having a nice environment and people that are willing to support you in your goals of whatever it might be for your particular birth. In our society in general, we have a tendency to strip women of their power, and we don't know how powerful we are because all of that stuff is taken away from us. And home birth can be one of those instances where you can reclaim that power. And midwife actually means with woman. So when I imagine midwifery, I don't imagine a hierarchical structure or a power differential, although I know one exists. But ideally, I strive to, instead of kind of leading my clients through their care, I'd like to stand beside them and walk with them through the journey of all of this, so that they can kind of figure out on their own what their power is. And I don't think that the role of the midwife is to necessarily empower women, but it's to provide education and a space for you to find your own power and step into that power on your own, which I think was achieved at your family's birth. Yeah,
but I think it's also, maybe I didn't explain myself very good, but I don't think it's the midwife giving or empowering, but it's the process that going through the natural birth, it is empowering the woman because she figures out after it has happened that she could cope with everything. She could, because the midwife has been given the options, like you say, you're not guiding the mother to do what you want to do, but you're just presenting the options. And is all the time the mother or the family, the partners, deciding at the end, like it was for us. And so I think the entire process itself, not the midwives, but it's part of it, of course, is then empowering the women and the parents as well, because I've been feeling like, I could say something myself as well, and I was not just there looking and the physician deciding what had to be done when, like it was for the other 2 births. Like, I didn't decide anything. It was just, okay, cut here the umbilical cord. I don't know how many minutes has passed, probably just a couple of minutes, and I did that because that was what was told me to make. So I was not really in the power of deciding. I was just in the power of doing what they were telling me to do. So it's very different. Any small event that you recall maybe of having a home birth with other children around, and you would like to say, without mentioning names or whatever, but something that really rested in your heart?
Yeah, one of my favorite births that I've ever been to, they had their first child present at the birth, and it was so special. This was a younger child, and the mom gave birth in the water, very similar to how you guys did. And it was very, very powerful experience for the child and also for the mother, and very much a family affair. But what a beautiful bonding opportunity it was for this child to actually be a part of the process, but also witness her brother being born, and yeah, just able to kind of take it all in. And I think that is a major part of why we're afraid of birth, is because we don't actually get to witness birth really ever. If you work on a farm, sure, you get to witness animals being born, but not
yeah,
many
again, the only
people.
part that you see from birth is what you see in the cinema, which is
Yeah,
is a fiction,
exactly. And so when you expose children in an appropriate way to beautiful natural home birth, you're able to have a conversation about it and have it be presented as very normal.
Yeah.
So you have, you know, kids that are older saying, well, it's normal for you to have a 14-hour labor or whatever, or it's normal for people to make those kinds of noises, and you just have the next generation being less afraid of having babies, which is really important. So I think it's nice for kids to watch their parents give birth.
Definitely, yeah. Right, so I think we've been touching pretty much everything, and again, thank you very much, Sequoia, for being here.
It's my pleasure.
And we're going to be probably doing more interviews back maybe in Switzerland and Italy to other midwives back there, to not only what are the differences of midwifery in different countries. And for now, thank you very much for watching us, and thank you, and enjoy your holiday.
Thank you.